One, I have a question, sir. It's not just for you, it's for Madam Sabha and all the faculty that's available right now. I have a case to discuss. It's actually of a friend. He's a 40-year-old male staff nurse, and he developed a road traffic accident. He underwent a road traffic accident. He fractured his elbow joint, as a result of which he visited the orthopedic surgeon. They advised a basic workup, and the basic workup revealed in CBC a platelet count of only 27,000. Since he's a friend of mine, he came rushing to me, and I just asked. It took some history regarding any possibility of bleeding in himself, in the family, any time in the past, and he refused all of that. And all the relevant history that I could inquire was that he was a chain smoker. Anyways, he eventually visited other doctors as well. Someone recommended that you should go for CBC from other sources as well. So he got his CBC done not just from the local lab, but from two well-renowned other labs as well. Once again, platelet count is 25, 27, not more than that. In the peripheral film, it was mentioned large platelets seen. That is all that was mentioned and nothing else. And afterwards, I advised him to go for the blood CP at Agha Khan as well. So he underwent the blood CP at Agha Khan as well. And once again, the platelet count was 25,000, 27, hardly 30,000, not more than that. And I encouraged him to consult a hematologist, and he said that my time is running out. I need to get the surgery done for my elbow joint. So he visited the orthopedic surgeon. The orthopedic surgeon transfused him with a mega unit of platelets, and he underwent the surgery. A few months later on, he had to undergo another surgery because it was the first level of surgery and then the second level of surgery. So he went for these investigations once again, and once again the CBC is revealing thrombocytopenia, the platelet count of 27,000, large platelets seen in the peripheral film, and nothing else. So I eventually told him to go and visit a hematologist. Now at least he should go and visit. He visited a lot of doctors. Some advised extensive workup, not just a BT, CT, coagulation profile and clotting factor levels, but some workup that even I could not comprehend, which was beyond my level. One hematologist eventually reviewed the patient's blood CP and told him that in reality it's just these large platelets that are being considered by the machine as RBCs. So in reality, it's actually those large platelets that are being considered as RBC, which is resulting in a false reduction of the platelets. So in reality, you do not have a low level of platelets. And she reviewed it on peripheral film, and she said that your platelet count, as per my assessment, is around 1,40,000 or 50,000, not less than this. I talked to that hematologist myself, and I requested her to give this in written, because I told her that no orthopedic surgeon would accept this, that the platelet count of 27,000, so we can proceed with the operation without any backup of platelets. So I needed your opinion on this. That is this a common occurrence that the kit of local labs, well-renowned private labs, in fact even Agha Khan lab, could not differentiate that these large platelets are actually platelets and not RBCs? This is my question. That is this a rare finding, or is it fairly common that the platelets were regarded as by the machine thought that it's actually RBCs? So it counted those large platelets at RBCs, and there was a false reduction in platelets. Thank you so much.
Was they lies, and then from the platelet pass for the same channel. So whenever there is any size, large size platelets, or they have the size of more than 3 to 4 micron, so they can go into the counting of the RTC. But in the peripheral smear, it's not. It's very easy to have the view of the platelet count on the peripheral smear for any expert pathologist or the laboratory person. Usually, you can only give the visual counting. There is no any authentic method. If you use using the Newborn chamber, and it takes half an hour to have the platelet count done on the Newborn chamber, so it can give you some idea. But usually the rule of thumb is that in the large, high power field, if you can view the 20 platelets, it means the patient might be having a normal platelet count. But this is again, I said, this is a very raw method. Not written in any books. So you can develop your own methods by using your experience. But Maybe this patient was having a low platelet count at that time when he was being undergone surgery or had the accident. This is incidental finding. Maybe this could be after the transfusion or if he had the transfusion. Was they lies and then from the platelet pass for the same channel. So whenever there is any large size platelets or they have the size of more than 3 to 4 micron, so they can go into the counting of the RTC. But in the peripheral smear, it's not. It's very easy to have the view of the platelet count on the peripheral smear for any expert pathologist or the laboratory person. Usually, you can only give the visual counting. There is no any authentic method. If you use using the newborn chamber and it takes half an hour to have the platelet count done on the newborn chamber, so it can give you some idea. But usually the rule of thumb is that in the large in the if in the large I mean the high power field, if you can use the 20 platelets, it means the patient might be having the normal platelet count. But this is again, I said, this is a very raw method. Nothing, not written in any books. So you can develop your